welcome back to my channel. If you can't tell, I'm driving. I know that it's not good to make videos while you're driving, but I have a long drive, so here we go. So if you can't tell, I have poison ivy on my face. My eye is a little swollen. That's what happens, I guess, when I try to be outdoorsy and I try to make my yard look nice. I get attacked by poison ivy. Great. Anyways, so I wanted to talk a little bit more about anxiety. It's something that I know a lot of people struggle with. As a therapist, I talk to a lot of people all the time about anxiety and how it affects them, and there's so many different levels of anxiety. A lot of people don't even really realize that they are dealing with anxiety. And with cancer, for myself, with breast cancer, I really feel like the anxiety that I dealt with was masked in a way where typically the anxiety that I would have pre-cancer was, did I complete an assignment? Did I complete my work correctly? Is the work that I completed going to be sufficient for my boss? Is my house clean enough? If my house isn't clean, what's going to happen? If I go out, like my husband and I, we take a lot of trips, and a big anxiety that I would always have whenever we were out on trips was, if my house was dirty and we died on the trip, who would have to come to clean my house, right? Like possibly my mother. If my house is dirty and my mom goes there, then she's going to just think the worst of me, right? But so that was pre-cancer. And that's just some examples. I mean, there's probably even more than that. But post-cancer, I would definitely say my anxiety's changed. It's not that I just keep like a dirty house all the time now, but I don't really care quite as much. It's just kind of one of those, like, I've learned like what a real emergency is and what truly becomes urgent and what is okay if it just waits. And that is definitely a silver lining of cancer. But I would say that now my anxieties are focused around recurrence. Meaning, is my cancer going to come back? Is that lump that I feel, is that cancer? Is this other lump that I have behind my ear, is that cancer? Is my hair falling out from chemo still, or is my hair just falling out because that's what hair does? If this poison ivy is really cancer, anxieties that I didn't really have before. And I've never really been the type of person that would get anxious at a doctor's appointment because I never really had to go to the doctors. I was usually relatively healthy. I was usually somebody that would kind of be only going to the doctor because I knew something was wrong. So now, after having cancer, if you don't know, you will go in for checkups every couple of months. So I have like 3-month scans, and then 6-month scans, and then yearly scans. So for the first 9 months or something after cancer, you go in every 3 months. And then after that, or maybe the first year, and then after that it's every 6 months for like a year or two, and then it's once a year. So because I am going through the process of reconstruction, I have more scans probably than I would if I had had cancer like on my leg or something. And so I am happy that I have a lot of scans, but at the same time, I do sometimes feel a little bit of anxiety going to the doctor. And again, that's really not something that I've dealt with before, because typically I would just go to the doctor, be fine, where now it's like sometimes even just sort of knowing that I have to go, I can sometimes feel a little bit anxious. So I am getting better, I would say. The breast cancer group that I was in, that I've talked about a few times, was really helpful in kind of talking about how to just decrease anxiety, which I already kind of like knew these things as a therapist. I use these things with clients, but as a person who's going through something myself, it's sometimes is easy to forget exactly what I teach people. So yeah, so with a surgery coming up, it's now going to be a few days away. I am a little anxious, and I think I've been anxious about it, but I have a really good way of masking things, and I really don't want to mask this, because it's something that last year when I went through this, I masked it totally, right? I hid it from myself, I hid it from a lot of people. But it was kind of scary, because I remember a few days before my surgery thinking, well, if I don't wake up, maybe I should have a plan in place, because, really, I mean, I was immunocompromised. I had been on a ton of steroids, and then all of a sudden I was off of them completely. I would be given all this pain medication, anesthesia, all these things that sometimes can have a really bad impact on somebody. Where this year, it's totally different. I'm not on any steroids at all, although I should be probably for this poison ivy, but I'm not as immunocompromised. I mean, I think I technically probably still am, but definitely not like I was. I think I really don't have a reason to hide the anxiety that I'm going through. Last year, I really felt like I had just completed treatment. It would be better for everybody if I just went into it super confident and didn't kind of tell anybody that I was afraid, but I was afraid. And this year, I am still a little bit afraid. Less afraid, because this year it's not making sure that I get the cancer out. This year it's, making sure that I am comfortable, and making sure that, my skin is going to heal, and all these things. So, I guess I am just, I'm in a totally different mindset in a good way. I really feel like I have the opportunity this year to truly invest in myself and truly invest in my own health, which is something that I was not doing last year. I was investing in my health as far as completing treatment and all of that, but as far as investing in my mental health and investing in myself and loving myself exactly where I am, that was not me last year, but that is me this year. So I am anxious about the surgery. I'm anxious to know what the pain is going to be like. Having an open sore on my back, basically, a long cut, and then having kind of both sides being affected this year, where last year that wasn't the case. Last year the case was just the one side, so I still had use of my right side, where this year will not be that way, and that's kind of scary. So I'm anxious to know what the pain's going to be like. I'm anxious to know what the recovery is going to be like. I think I'm anxious to know kind of what it will be like to have to depend on my husband so much. So with COVID this year happening, we really don't want a lot of people in our home, especially people that are out and about and around other people all the time. And I think it's kind of been hurtful for some people to hear that, but unfortunately, that's just how it is. A lot of my friends are therapists. A lot of my family works in the public, either in a hospital or, with people in an office. So being able to have them help is really tough. And, it's fine because my husband has been able to take off the time. And, I've kind of found that other things are helpful. So, so like, for example, like my mom, like she wants to be helpful, but she works around people. And so the way that I felt that she could be helpful is by having her create dinners for us. So she will be cooking meals and delivering them. And she enjoys, cooking, and so that's something that will be helpful for us, is to just have like one less meal that we have to kind of cook and worry about. And I have dietary restrictions. I've been trying to not eat dairy, and I have a gluten allergy, so it kind of limits a lot of the things that I can eat. And so that's something that she, kind of has to work around. But other than that, I'm just hoping that everything will go very smoothly, but it still is anxious, causes me anxiety to think about all of the things that could go wrong. And so one of the ways that I am combating this, so I have, of course, all this anxiety, but then a way for me to sort of help myself to like zen, kind of come back down to earth a little bit, is to think about all the things that can go well. And so for me, one of the things that I think will go very well is my eating. So the bad part about having surgery on both sides is that, you can't really use both of your arms all the time like you normally would. So that might include getting unhealthy snacks and, so now that I won't be able to use my arms, the good thing about not being able to use my arms is not being able to get unhealthy snacks. So that's something that I am, I laugh about, but it's true. So hopefully, my husband can kind of help me out with that too. And another way that I am, so besides kind of seeing the silver linings of things, another way that I am sort of combating a lot of this anxiety is just by visualizing the end result. So in the end, I want to have breasts that are nice and that are healed well, and that I can, wear a shirt with and not have to, add these little cup things to. And I think that, kind of having that end result in mind will be really helpful when I'm in a lot of pain. And I think that it will be really helpful when I am in, a week in and things are itchy and I'm wondering, what the heck am I doing? Why would I do this? Like, why don't I just stay flat? And so, so that's kind of my goal with anxiety, my current anxiety, and my goal to combat that. Thank you so much for watching my video, and if you have any questions, please feel free to let me know. Thanks. Bye-bye.